I'm Dr. Daniel KAntor, Neurology in Real Time. I'm joined here by Dr. Feinstein, who is Professor of Psychiatry at the University of Toronto. Thank you so much for joining us today. You're in a session where we're talking about affective disorders and multiple sclerosis. Many people at home don't know what that term means. What is an affective disorder?
Yeah, I think the bottom line is these are mood disorders, so disorders of mood and feeling. So things like depression, you could add on anxiety to that, bipolar affective disorder. Some patients become euphoric, which is a discrete syndrome, and there's also a condition called pseudobulbar affect. So that's the collection of disorders of mood and affect that you see in people with MS.
Are they more common in people with multiple sclerosis?
Yeah, so the rates are increased, particularly depression, where the rates are probably 3 times as high as the general population. But even with bipolar disorder, there's good data to show that the rates are double what you see in the general population.
Sometimes people talk about an MS personality, and it's hard for us as clinicians, as neurologists, to know, is this how the person was before the diagnosis of MS? Was that because they actually had MS and it wasn't diagnosed? Or does this have nothing to do with their multiple sclerosis? Are there ways that we can tell the difference?
Yeah, I mean, I'm not a fan of the notion of MS personality. I think, people with MS have the same kind of personalities as anybody else. Then you get this disease, which is a tough disease, and it can change how you feel, it can change how you think, it can change your cognition, and that, of course, you pick up clinically, but I don't believe the notion of an MS personality.
You mentioned pseudobulbar affect, and what makes PBA different than the other ones is PBA is more about the affect, whereas the other ones are more about the mood. What do you think about the statistics, the epidemiology out there now about how commonly we see PBA in people with multiple sclerosis?
Yeah, you're quite right. So PBA is a disorder of affect. So these people cry when they don't feel sad, or they laugh when they don't feel happy. And the data suggests, at least from my lab, that it affects about 10% of people with MS, with varying severities. So it can be quite subtle to the full-blown pseudobulbar syndrome, where people just can't stop crying or laughing, but around about 10%.
Yeah, as one of the authors of the PRISM study, where we looked at the PBA registry series, I was actually made fourth author because I didn't like the title. It wasn't a registry. A registry implies a drug registry, a pregnancy registry. We were doing a point prevalence epidemiological study of pseudobulbar affect and 6 underlying neurological conditions. We found a much higher potential prevalence, but we didn't really examine people. What we did is we used a scale called the CNS, or the Centers for Neurologic Studies Lability Scale. What do you feel about that scale?
Yeah, I think it's a good scale. I mean, they used it for the large PBA study of dextromethorphan and quinidine in people with MS, and they got a really good result. So I think it's a useful scale. It's quick, it's easy to use. There are other scales, as you know, more detailed, but I think it's a useful screen.
One of the things I've noticed is we talk a lot about laughing and crying, but there's a much more common affect, at least in the United States. Not so much in South Africa or in Canada, but in the United States, anger is a major affect, and being angry is a major mood. What do you think about those as being part of the possibility of a spectrum of PBA?
Yeah, it's a good question. I mean, I think you're right. Irritability is certainly very common in people with MS. You see it a lot more often than the typical laughter and crying. But the neat, clean definition of pseudobulbar affect is, you laugh when you don't feel happy and you cry when you don't feel sad. If you go and look at a really interesting chapter by the author of the name of Poeck, P-O-E-C-K, in a large neurological text called Thinking and Brain, he writes about the spectrum, and he actually brings in things like irritability and anger as part of a inability to control your outward show of emotion. So, you can't control your crying, you can't control your laughter, but you also can't control your anger and your irritability. What's interesting in my clinical experience is that anger and irritability responds really well to medication, a selective serotonin reuptake inhibitor, and response is quite quick, within about 48 to 72 hours, a little bit like the response you see with pseudobulbar affect, a fast response.
Well, Dr. Feinstein, I want to thank you so much for joining us and for clarifying what's sometimes a difficult conversation, but also for interrupting your talk right before you're about to give it. You're so kind to give us your time. Right. So thank you, and thank you to all of you at home for joining us at Real Time Neurology.